Good evening, everyone. Welcome to Macro Social Work Stories, where we're able to hear the lived experience of social workers from the macro social work perspective. Today, we have an exciting guest, Dr. Tom Felke. He's the Associate Dean of the Health and Science Services and he's also Associate Professor within the Department of Social Work at Florida Gulf Coast University. He's worked at Catholic Charities, a number of things. He's also worked in Connecticut Department of Social Services. So he's worked with individuals, communities to bring about the change in that process. And he focused on research as well as macro social work, implementing technology. We know that over the last 2 years, many social workers and agencies have integrated technology in the work. So we're going to talk about technology, and we're going to emphasize on his major focus with Geographic Information Systems, with evaluation and research working with the vulnerable populations. So today, we'd like to welcome Dr. Tom Felke to our broadcast. Welcome.
Thank you very much for having me.
All right. So we'd like to begin our broadcast with just asking a simple question. Give us one fact about yourself that you feel is interesting that our listeners should know.
Well, I always kind of joke and say I'm a social worker, but I'm not that kind of social worker, because a lot of people just automatically assume that when we say I'm a social worker that, I'm a clinician. And for me, that macro identity has always been a big part of who I've been, both in my academic training as well as professionally. So, it's become this running joke, but it's also become something really important to me with my students. Because when I arrived here to FGCU, there wasn't a lot of focus on macro social work, and there wasn't a lot of focus even on what social workers did outside of the clinical arena. So it was a great thing. It's actually one of the reasons why I chose to come here to FGCU.
Yes, it's very important that we teach our students, colleagues, and community have a balanced perspective of what social workers do. I tell everybody where there's individuals, we're needed, communities, agencies, and policies. And so when you talk about your focus trying to create an atmosphere where macro is a part of the talk with social work, how was the students' gravity towards that? What was their their mindset when you talked about the broad aspect of what social workers can do?
It was interesting. Among a lot of the students, I think there was a little bit of a sense of relief, because I think a lot of them wanted to be engaged in the field and they wanted to move on for a master's degree. But I think a lot of them were a little afraid of that because they thought, well, I'm going to have to be a clinician. And I think, my arrival here and being able to talk students through the fact that, a lot of individuals get trained clinical, but still end up in the macro side. And that it's not a division between micro and macro, that it's absolutely the combination of the two coming together that we really need to focus on. And so we've had students now who have graduated from our program who go through, we don't have a macro track here, I would say yet, because it's something I would love to see us do one day. But we have had some students that have gone through our MSW program, and after graduation we've had 4 students who have founded their own nonprofit agencies locally here in Southwest Florida. And I don't by any means take credit for that. But I think it was helpful for them to see the roles that they could play in social work besides becoming a clinician.
Okay. You know what? I think it's interesting when you said that. I realized we graduate MSWs as macro, and we don't say that. And I think maybe we need to start saying that in the classroom, because you don't have to go train for however many thousands of hours it is after graduation to get your clinical license in order to start macro work. So it's something you can do. And I know in my experience, I kept going because it was the thing that you have to do. And I did it as fast as I could. So I made sure to get that clinical license right away. And then I ended up teaching for 12 years, doing some on the side, but it wasn't, I don't think it's described very well to us when you're a student on the options that we have. And I don't know if I would have just kept going. So, you get on the roll and you feel like if I don't do it now, I'm not going to do it. And that's not necessarily a bad thing, but you could be starting your macro work straight out of the gate, even while training for clinical, which we need more of an integrated perspective. It's not either or necessarily, and that we need to be involved and practice what we just learned, because I think a lot of us lose the macro training that is pretty small as it is in a lot of the programs, and then we lose it. It's 4 years later when we start getting interested, or 10 years down the road. So I hope we start integrating more of the messaging that you're already a macro social worker. You don't have to go get an additional license, at least at this point. So how can you use that part of your training as you enter whatever field you're going to enter? So thanks for bringing that up.
Yes. Can you share how technology has influenced your work as a social worker?
Yeah, so it goes back to that little piece about social worker, not that kind of social worker. I'm one of those guys who was just always interested in technology. I'm self-taught with Geographic Information Systems. I actually learned it in a way out of necessity. In my first job at Catholic Charities, I was managing a school readiness grant, multi-million-dollar, and the funder came back to us and said, "We want you to run your own childcare centers." And I'm a kid from Philadelphia. I'm working in Connecticut. I have no idea anything about the state by and large. So Geographic Information Systems for me originally was a necessary tool to try and figure out, okay, where am I supposed to put childcare centers in Southern Connecticut? And so luckily, I had enough knowledge with technology to teach myself how to use GIS. And by utilizing that tool and the available data from a number of state agencies and local organizations, we ended up founding 3 childcare centers in Southern Connecticut to, work with, primarily low socioeconomic, income families and that level. And what's great about that is, all these years later, that was back in 1998, and all these years later, those childcare centers still run. So it was really, for me, that was kind of my piece. But, I was also really fortunate when I'm a proud alumni of University of Connecticut, where they did have macro track, right? And so for me, I never really gave that macro piece, kind of a second thought, because it was just always what I was trained in. And I also was very lucky to meet an individual by the name of Pete Petrella, who was an adjunct faculty member who was teaching a course called Computer Applications in the Human Services, which again was something I thought about, but I didn't think about it as a larger topic. So I worked with Pete. I ended up doing my internship with him, and I ended up getting my second job in the profession at the state of Connecticut Department of Social Services with him. And, that's where, he really allowed me to grow that idea of how to best utilize technology in the social services. And now we see how that's even come into things like the grand challenges of social work. So, for me, it's been a great kind of career track. I know it's not for everybody, and I try to bring it in wherever I can to help build capacity with my students.
Yes, thank you. When you talk about computer application, and you're talking about the Geographic Information Systems, we know that a lot of data is gathered. For someone who has never utilized that type of system, what's a 101 breakdown of a Geographic Information System?
Yeah, so the fact of the matter is probably more people know what that is today than ever before, because we all, the majority of people have smartphones, and they've used the GPS to get them from point A to point B, whatever that's for. The Geographic Information System is basically the same type of technology. The difference is it's a little bit more focused on visualization, right? So if you want to look at where all the individuals living below the poverty line reside in a community, that's a good use for a GIS. It's basically the combination of spatial data and attribute data, and joining those two things to create a visual representation of that community in their environment, which is why I think GIS fits so well with the person and environment perspective in social work.
Yes. So person and environment. A couple weeks ago, we talked about disaster relief. How could this tool aid if there was a disaster in a part of our nation or a part of our world?
Yeah, so that's actually one of the big places where we see that happening the most. Is there's a lot of that. So when I was at the state of Connecticut, for example, I was part of what was known as the Governor's Geospatial Information Council. And our job really was to create maps of the community in terms of the resources that we have available. So at social services, for example, I was mapping out where all of the offices were, where all of our distribution points were for different things. And I was working side by side with people from the Department of Transportation. They were looking at how to reverse flow streets and highways. And working together with all these different groups, we were able to, in the event of a disaster, create this, really comprehensive view of the state of Connecticut then, to show exactly how we would do this. And I mean, we were planning for, there was a power plant, nuclear power plant in Groton, Connecticut. So we had all kinds of training scenarios for things like that. And unfortunately, it ended up becoming an active thing with 9/11 because we were so close in Connecticut to New York that we did end up having to reverse flow the highways and so forth. So it actually became a very practical thing for us in a very unfortunate manner.
Yeah. Yeah. And so this tool, the Geographic Information Systems, utilized to capture data, gets a snapshot of different communities. And you talked about economic status. It can calculate those who have different economic status, probably educational status. It can locate, it could also help quality of life. We know that different communities, it impacts the quality of life. So how can this tool aid emerging social workers who want to fight disparities, inequities, injustice, and different, who want to focus on community change?
So I love this quote that comes from Jack Dangermond, who's the creator, the founder of the company who created the GIS software I use, which is ArcGIS. And he says, GIS is only bound by the imagination of those who use it. And I think that's absolutely true in our profession. I mean, you can apply, and I teach my students this. I have them doing in my Practice 3 course. They're using GIS right now to do a community analysis, and they're all doing it on different topics. And so that's the beauty of GIS. If you have the data and that data has a spatial reference, whether it's a zip code or a street address, whatever it is, you can put it on the map. What I always tell my students is, let the map tell a story. Don't just make a pretty map. So for example, one of the first projects I was involved in here in Southwest Florida was a look at the needs of older adults. Obviously, we have a high population of older adults here in Southwest Florida, but there was a lot of confusion about what they needed. So we did some focus groups to talk to older adults, and then I mapped out the entire community in Southwest Florida for an area called Collier County. And that ended up leading to the development of 3 senior access centers in Collier County. And since then, we are in development for 2 more. And it's all based on the ability to map out the community, show where the older adults are in various ways. One of the biggest things we found, for example, was that there's a large percentage of these older adults that live alone. So that socialization piece was really the biggest piece that was missing. But if you had talked to people at the time, they would have told you, oh, public transportation is the biggest issue. But we talked to the older adults and they said, yeah, I'm not getting on a bus. I like to drive. I like my independence. I just wish I had people to talk to and be with. And so that became a really big part of it.
Yes, yes.
I have kind of some free floating ideas here that maybe you can put a map around, Dr. Felke. But I've been reading more about federal opportunity zones lately, and I've been thinking about a guest we had. Gosh, was that a couple months ago, Gary? The one who was talking about investing in your own buildings. Quite literally, she was talking about clinicians. So they might be micro clinicians, but investing in the community they're in and having a financial stake in it so that you're not paying rent to somebody else, which greatly reduces your income, right? So even gathering with other like-minded clinicians to purchase your own building. So I was thinking federal opportunity zones are places where, and I don't know if you've heard of it, but it's where you basically, if you invest in certain areas that are federally designated at this point, and you can use, it's not a full mapping system, but each state has one. And if you invest there, there's huge tax benefits, no capital gains, up to 70% more like influx. There were a lot of things attached to that I don't think are well advertised outside of the top 1% in the country. So perhaps when you start looking into things like that as well, to where we're actually investing in our communities where we work, and you could be doing something that's both macro and micro, provides jobs and all of that, and getting other social workers, teachers, et cetera, to purchase in the neighborhoods that we're actually working or want to improve.
Yeah.
So
I think that's a great idea, Christy. And I mean, I talk to my students and I tell them, I don't care what facet of social work you plan to go into. Even I've talked to some of my students about, if you're going to be a micro practitioner and you're talking about setting up your own shingle, where should that happen? GIS can even help inform that. It's more of a business minded thought process, but at the same time, trying to figure out where are the individuals. And here in Southwest Florida, that's critically important because we're in a mental health desert down here. Our ratio is like 1 therapist to 960 potential clients. So we're really way off. So even using GIS in that regard to see where are the individuals that are in most need, so that, we look at it in terms of targeted programs and services. But, if, like I said, to your point, if you're looking at that investment, even that personal investment as a professional, there's a potential use for GIS.
that doesn't even sound like a Venn diagram. It sounds more like overlapping circles where the need might be and the opportunity zones, which a lot of the issues in communities like this are a lot of different deserts or a lack of services, food deserts, all of the rest of it seems to be overlapping. So great ideas.
Yes. So this tool allows you to capture data. It allows you to see what the needs are in the communities, and allows you to do focus groups, because sometimes we may have our assumptions, our biases, our beliefs. Society may put a picture about certain community, but until we hear the voices of individuals we partner with, change cannot happen. And so that's how micro social work and macro are combined, because we're on a direct interaction with our clients, as well as looking at it from a global perspective. How does policy, how's communities develop it, all that process aid in bringing about desired change in that process. So thank you for highlighting that. As a dean at your university, how has technology influenced the work that you do?
I mean, in every single possible way, it seems lately. Obviously, with the work that I do in GIS, it's pretty much at the root of everything I do. Christy mentioned food insecurity. That's really if I have a 1 and a 2, it's more of a 1A and a 1B. My work is primarily on older adults and food insecurity. And then followed up right behind that is affordable housing. So that idea of overlapping circles, that's actually how we talk about GIS in terms of layering the data. So we even use it for field education placement. So our students don't go to a directory anymore. We have an online map of all of our field agencies, and students go to the map. They can filter that map out for, what county do I want to be in? What type of agency do I want to be in? What population do I want to work with? And it zeroes that map in for them. And then they can click on the points of the map to find out more, because we have that link directly to the website for the agency. So we do it that way. And then beyond that, it's, like I said, every aspect of research and evaluation that we do, we generally include a map with it. We're getting ready to do some strategic planning for our college. And now one of the things that we're looking at are, where have our alumni gone to? So they started here at FGCU. We're a comprehensive regional teaching school. Students come here, they get their degree. Our focus is on workforce development. So now we're using the GIS to look at, where have our students come from, and then where are they going? And what we're finding is a lot of the students here at FGCU, the way I like to say it, they're homegrown and they stay home, right? Because they are seeing the challenges in their local communities, especially those where they were born and raised, and they're staying here to help change those communities. So it's a really kind of inspiring piece for me to take a look at and be able to visualize it in that way.
Okay.
I think you actually answered what my next question was going to be, but I know all of us get to be talking heads sometimes. But if we have newbies or those who aren't generally interested in what we're talking about. If I were to catch you in the elevator and just said, "Hey, Tom, what is GIS?" What would you say?
Yeah, I'd say it's a way to visualize data. I mean, at the end of the day, that's really what it is, and we're seeing that more and more. The need to be able to visualize. I mean, obviously, we've all heard the adage, "A picture's worth 1,000 words," and I think that's a very beneficial adage. But I always caution my students with make sure there's a story behind it, and I think that's what's really developing with GIS is that the technology is becoming less static and more dynamic. We're able to do more in terms of longitudinal analysis. We're starting to look at predictive analysis. We can even do a lot more with community-based action research because a lot of the technology is becoming smartphone-based.
Yeah.
Well said.
Yeah. So as we look at housing instability or housing issues for many communities, how has the tool GIS tool aid in trying to find affordable housing, adequate housing for the clientele we work with?
Again, here in Southwest Florida, we have a huge income disparity. Affordable housing is basically non-existent. I sit on the boards of both of our local hunger and homeless coalitions. And so I'm bringing that directly into my work with the boards as well to help guide the development of programs and services. But again, what we're able to do is we're able to map out the population locally. And we know that affordable housing is not just a single aspect. Access to it is one thing, but people being able to actually afford their homes is another part of it. So being able to take a look at that, visualize who the population is, visualize where we have available resources such as land, which here in Southwest Florida, everything is being developed currently. The market has just skyrocketed. And unfortunately, one of the affordable housing complexes that we did have here locally was just purchased, and the new developers have signaled that they plan to destroy what's there and build luxury high-rise condos in its place. And so, I was able to map all of that out and show what that displacement potentially is going to look like in terms of if these individuals are displaced from their current residence, where are they likely to go? And then what does that mean in terms of transportation to work? What does it mean in terms of childcare? What does it mean in terms of opportunity costs? And very thankfully, it was picked up by our local newspaper here, and they published it, and it actually has started some conversations about the need for more affordable housing.
Yeah. That's some good work. That's some good work where you're able to give a broad perspective and show how the impact of a decision to bring about someone coming to community to bring about change, to displace homeowners, to displace individuals who have lived there for centuries, maybe not centuries, but lived there for generations. And so now that this tool is able to give a broad perspective and to bring about hopefully policy change when next time someone comes in the community to talk about housing, because they like to talk about affordable housing, but we know that gentrification is a serious issue.
Have you guys gone on? There was a newspaper article a couple of weeks ago that got me started on some of why I'm looking at this. But if you go in and look at Zillow and Redfin and the rest of it, they're trying to buy your house. They're trying to buy every house in the neighborhood, and it's a bit scary. So it's almost like they make you an offer that you can't refuse. That's pretty easy and straightforward without having to pay realtors. And so people are selling their houses that maybe they weren't going to sell, but it's a good offer in this market. And when you said that, it made me think of it. So I'm wondering if social workers are more involved in this sort of policy making or opportunity, that we have a voice here, and it does need to make opinion and news articles locally so that we can talk to people about how we not necessarily stop it, but put our hands in it. No, we're going to actually use a nonprofit to buy this back for ourselves, keep it in the community. And so maybe everyone gets a small stake in the building, something overlapping what we were talking about before in an opportunity zone, rather than having the big developers come in and buy the entire thing and rent to everyone. So, and that's actively happening right now. So it's the opportunity for them to turn everyone into renters is a forever gold mine. And so it would be nice to see us repurpose some of these actions for ourselves in a more altruistic way.
Absolutely.
Yeah. So as we wrap our time up today, we want to thank you for being here with us as we looked at how technology, how the geographic information system can be utilized to bring about change and give a snapshot of communities. I like to ask the question, if an emerging social worker and as a field instructor, I plan to utilize this tool. I never thought about utilizing this tool to individualize field placement, my field students. And so this tool will be utilized in the future by myself to place students in the field to make sure that it's accessible to them, as well as it's meeting the needs that they have as they emerge as social workers. And so, can you share some products you have coming up with research or this tool?
Yeah, so we have an article coming out hopefully pretty soon. It's just been submitted for publication, which is a case study on how we utilize the smartphone app that I discussed before to do some community-based action research in a community here called Immokalee, which is a kind of depressed farm worker community. And we were looking at food access. So, really creating a food access map of the community. Where are all the locations that somebody could access food? And then our plan is to go back and do focus groups with those individuals to find out why they are shopping where they're shopping and why they make the decisions they make around food. We've done recently, we did a COVID-19 dashboard that really helped to individuals to visualize what the pandemic looked like locally here, which was really important because we have a really high snowbird population, individuals coming back and forth. So that was a big piece. And we're just continuing to develop in those ways and looking at more and more unique ways that, we can utilize this technology to best illustrate and visualize, what's going on locally. We're about to go into an early legislative session here in Florida in January. So I'm very fortunate. I'm teaching, macro practice this semester. I'll be teaching social policy next semester. So I already have my students, utilizing GIS in the classroom to visualize an issue and then see how that can potentially be utilized during legislative session to possibly help influence policy.
Yes, very interesting.
Wonderful.
Yeah, because we know that Florida has numerous things going on where they have the theoretical arguments as well as dealing with reopening of schools, as well as a number of things. And so there's a lot of case studies that can be done.
I wasn't going to say that.
Across our nation in that process. Dr. Holmes, any questions, final thoughts?
No, I was thinking mostly just this is a great way to pull in students. Research is hit or miss often with them, and this is a great way to pull them in. I even know with my now 9th grader, the class is more enthusiastic because they're having them research a topic of their own in order to make a persuasive argument. And it's hard to capture kids even for doing something like that. But now that they said, go ahead and ask this question of the parents, we had to answer the survey yesterday. But essentially, they need an extra 10 or 15-minute break every day to have nutrition. And so it's all the reasons why they should have this extra break during the day. And at his school, they have 1.5-hour classes. And as I was reading, I'm like, it's actually a good point. I can see how it could be abused, but good point. And so the kids are actually trying to persuade the school and to change the policy, and they're finding reason to be doing it. And I know it's a tiny example, but getting them involved, kids who would not want to really be doing research right now or write a persuasive essay are not actively into this. And so I assume the same will also happen for our students wherever they are, whatever topic it is, if they see that what they're doing And they can first visualize it, and then they can also be confident about what they're seeing rather than just kind of playing off other people's theories and having to do a lit review. They can actually see it.
Yeah.
So thank you so much for your work.
Yes,
Fascinating.
thank you. Yes, thank you for joining us today. And we look forward to reading your articles and implementing some of the strategies that you utilize to get a snapshot of communities. It's very important. In order to partner with communities, we have to have a perspective of what they offer and what they bring. And so having a two-pronged approach, using technology, but also connecting with the community, can aid in bringing about change and bringing awareness and attention to the needs of those who we serve. So thank you for being with us. And to our replay squad and those who live, we'll see you in the next video.
Oh, wait, Dr. Burghardt. Oh, no.
Yes.
I was going to say we forgot to give him the last word. Dr. Burghardt usually says that. So
yes, last word.
Last word.
Doctor.
So, I mean, again, thank you so much for the opportunity today. I'm always happy to talk about this. My big thing is I want to see more capacity building for GIS in social work. There are a few of us out there who are doing this work, and I really hope that this is something that we see pushed more. I know where there's so much in our curriculum already, but any opportunity to kind of place this in there, I think it would just be so beneficial for our students and for the profession at large in terms of the kind of really positive work that can be done in our local communities that we're expecting our students to go out and do.
Yeah, it's critical.
Modernizes us.
Yeah, it's vital. Yes. Thank you all, and we'll see you next time.